Tinnitus Retraining Therapy, TRT, by Charles Smith-Dill MD. www.tinnituscontrolcenter.com. Tinnitus retraining therapy relieves suffering from tinnitus in approximately 85% of trainees, but it requires 12 to 18 months to become effective. Developed in the 1980s by Dr. Paul Jastroboff at the University of Maryland, this therapy works through a process called habituation. TRT consists of two closely integrated parts. A. The use of sound therapy, and B. Counseling by a knowledgeable professional. Your conscious mind can pay attention to only a few hundred bits of information at any given instant. There are thousands of bits of information constantly bombarding you, some deemed by your mind to be more important than others. Your conscious mind chooses to ignore stimuli not deemed threatening, exciting, essential to your survival or well-being. That is, your brain ignores things it considers unimportant. Any new stimulus will always be noticed and evaluated by our brains as to whether it presents a threat or warns of danger. Your mind learns to ignore any recurring stimulus that it considers unimportant. This is called habituation. One of the goals of TRT is to teach your brain to consider your tinnitus so unimportant that you will automatically ignore it unless and until you choose to hear it. Sound therapy in TRT consists of presenting a second or new intruding sound to your ears, with that sound being far less intense than the tinnitus in your head. When a new sound is first presented, you notice it because it's new, and the limbic system in your brain needs to determine if it's threatening or warning of danger. Your limbic system quickly determines that it's not important, so it pushes it into the background. In so doing, you ignore the new sound as though it doesn't exist. This process is slow, but while training your mind to ignore this new sound, your mind also learns to ignore other unimportant sounds inside your head, including your tinnitus. Professional counseling is an essential component of TRT. Studies have shown that sound therapy alone results in far less improvement for tinnitus sufferers than the combination of sound therapy and professional counseling. The primary aim of professional counseling is to remove negative emotions associated with tinnitus, such as anxiety, stress, and fear. 75% of all people with tinnitus automatically habituate the sound and generally ignore it. 85% of those who initially suffer show significant improvement following 12 to 18 months of TRT. My issues with this therapy are the cost involved and the length of time required for relief. TRT trainers typically recommend that a professional sound-generating device similar to a hearing aid be worn 24/7. These devices are quite expensive, often costing upwards of $2,000. This can also be accomplished for less money by playing soft music, white noise, or nature sounds on a CD, through a computer, via special CD player pillows at night, or through sound-generating devices from electronic stores. Energy psychology methods, such as EFT and anxiety relief techniques, a registered trademark or ART, directly unhook the subconscious fear response from any stimulus or thought held in the conscious mind. In so doing, anger, fear, frustration, and anxiety associated with tinnitus can be eliminated within hours, rather than weeks or months. These methods utilize the body's meridian system, and are similar to acupuncture only in this regard. Acupuncture alone is not generally effective for relieving fear and anxiety from tinnitus. EFT and ART are highly effective. Dr. Smith-Dill is a board-certified ear, nose, and throat specialist, now retired. Visit www.tinnituscontrolcenter.com for more information.